All right, if you're a medical coder, you know pregnancy codes can be tricky, right? And one of the biggest tripwires is definitely gestational diabetes mellitus, or GDM. So today, we're going to demystify the whole thing. We'll break down the ICD-10 guidelines so your GDM coding is always on point, totally accurate, and yeah, completely audit-proof. Let's dive in. Okay, so here's our game plan. First, we'll get a quick handle on the clinical definition. Then, we're jumping straight to the single most important code you need to know. After that, we'll get into the nitty-gritty of control and timing, cover what not to code, super important, and clear up a really common mix-up. And we'll wrap it all up with a simple checklist to make sure it all sticks. Sound good? Let's get started. All right, first things first. Before we even think about touching a code, we've got to understand what's actually happening clinically. Why? Well, because without that context, accurate coding, it's pretty much impossible. So here's the absolute key for us as coders. GDM is not the same as pre-existing diabetes, not at all. It's a temporary thing that pops up during pregnancy, usually in the second or third trimester. And this is crucial, it almost always goes away after the baby is born. You have to get this concept of it being temporary because trust me, every single coding rule we're about to talk about hinges on that one idea. Okay, so we know what it is. Now let's talk about how we code it. And when it comes to GDDM, there's really one core code subcategory that you absolutely have to know inside and out. This is it, 024.4. I want you to burn this one into your memory. This is the home base for every GDM code. It's your single source of truth. But, and this is a big but, right out of the gate, there's a critical rule attached to it that you just cannot forget. And this rule, it's totally non-negotiable. If you assign a code from 024.4, you are not allowed to assign any other code from the entire 024 category, you know, the one that covers pre-existing diabetes. Mixing these up is probably one of the most common errors out there, and this guideline is specifically designed to stop that from happening. Bottom line, GDM stands alone under 024.4. Okay, so 024.4 is our starting point, our subcategory. But obviously, we need to get more specific than that, right? To actually assign the final complete code, the documentation just needs to answer two simple questions for us. When is this all happening, and how is the GDM being managed? It's a really simple two-step process. First, you look at the encounter. Is it happening during the pregnancy itself, during childbirth, or in the puerperium? You know, that period right after delivery. Got that? Okay. Second, you look at the treatment plan. Is the GDM being controlled just by diet, or is the patient on some kind of medication, like insulin or an oral hypoglycemic? Once you've got those two pieces of info, boom, you can pinpoint the exact code you need. And this leads to a super important hierarchy rule. So what happens if a patient is on a special diet and they're on medication? Which one do you code? The guideline is crystal clear. Medication always wins. If you see any medication documented, you have to use the medication-controlled code. You never, ever code for both. Okay, we spent a lot of time on what to do. Now let's flip it and talk about what not to do. And believe me, knowing these exclusion rules is just as important if you want to keep your coding accurate and avoid those frustrating denials. Okay, this is probably one of the biggest mistakes coders make with GDM. Remember how we kept saying GDM is a temporary condition? Well, that's exactly why you never use Z codes for long-term drug use like Z79.4. Those codes scream chronic condition. The right 024.4 code already tells the whole story. It tells us medication is being used specifically for this pregnancy. Adding a Z code isn't just redundant, it's clinically wrong. All right, let's clear up something that trips up a lot of people. What happens when a pregnant patient has an abnormal glucose test, but the doctor hasn't officially diagnosed them with GDM? How in the world do you code that? It's actually pretty simple. It all boils down to what the physician has documented as the final diagnosis. If the provider writes gestational diabetes, plain and simple, you're using 024.4. But if the documentation just says something like abnormal glucose tolerance and doesn't confirm GDM, then you have to use a code from 099.81 instead. These are two totally different clinical situations, and they get two totally different codes. And this leads us to an absolute 100% unbreakable rule. These two code categories, they are mutually exclusive. You can't use them together, ever. A patient either has GDM
Or they have abnormal glucose tolerance. They can't have both at the same time. So on the claim, it's one or the other, never ever both.
Whew, we've covered a lot of ground, right? So let's pull it all together with a quick reference checklist to really lock in these core ideas. Okay, let's lock this in. Ready? Number 1, GDM lives in subcategory 024.4. That's its home. Number 2, never ever mix 024.4 with any other 024 codes for pre-existing diabetes. 3, no Z codes for long-term drug use, just don't do it. And 4, 024.4 and 099.81 for abnormal glucose are mutually exclusive. It's one or the other, not both. Seriously, if you just stick to these 4 rules, you really can't go wrong. So, next time that chart with gestational diabetes lands on your desk, just run through that mental checklist we just made. Mastering these little details is what really separates a good coder from a great one. Because at the end of the day, we're not just plugging in codes, are we? We're telling the patient's story, accurately and with precision,